This is Tampa Bay's 10 News This Morning.
And welcome back to the morning show. It's 6:13, and this morning we are getting an exclusive look at something that may have never been shown live on television in Tampa.
Right, a Clearwater woman getting 3 liposuction procedures. As our cameras are rolling, again, it's happening live. 10 News reporter Janie Porter's been at the Bassin Center for Plastic Surgery in Tampa all morning long. So, Janie, what made this woman agree to do this? Obviously, we know that it's hard enough for some women to go ahead and do the procedure itself, but she agreed to do it live for us.
She did. You know, she said she's always wanted to get this done, Keith and Ginger, and she's a nurse, so she can't be down for days at a time, as could happen after traditional liposuction. This is called Aqualipo, and the difference is she is awake for it. Felicia is wide awake, kind of mind over matter right now, pretending she's not in this room with the crazy TV cameras. I got some friends here. We got Charity here, we have Felicia here, and Dr. Rigo Mendoza, who is using the water sprayer right now. What is Aqualipo for people who don't know?
Well, basically what we're doing right now is we're using this cannula to take out the fat, and this is called the water jet. If you want, I'll show you. It shoots a spray of water out, and the water is what dislodges the melted fat and washes it out, so we can remove it a lot gentler and less trauma.
Kind of like a power sprayer under the skin.
Exactly, but much more gentle.
Brand new in the U.S. Tell us more about that.
The machine was developed in Germany, and it came into the United States last year, and we were one of the first practices to start using it and getting great results with it, because we were able to do it under anesthesia, which patients are really looking for because they have less downtime, quicker recoveries. What
is it like being awake for this, Felicia?
I feel a little pressure, but it's not something that's unbearable. I mean, it's just a little pressure. It's like not that bad or not that intense.
You seem very calm. I don't know if you're putting on a show for us, but you're doing a great job just relaxing yourself, laying on the table here. You're having your abdomen, the sides, they call them the love handles, and your chin worked on while we are here live this morning. What area were you most nervous about?
My abdomen.
Yeah, and that's what's going on right now.
But the area that I really wanted done the most was my chin.
And we're going to get to that next. It only takes 5 or 10 minutes to do the chin area. That's another thing that doctors say they really like, is that there's really less time required to do the procedure itself as well, you guys. So brand new thing happening here, and we're here all morning long to show you how it's done.
Yeah, I have to admit, I'm a little bit squeamish, and every time they go to show the thing, I have to look away. And, you know, she's a nurse, so she knows some of the dangers of what's going on. But I was talking to a personal trainer yesterday, and he says inevitably she's going to have to work hard to maintain her new svelte look, because some of that's going to come back no matter what. Is she ready for that?
Are you ready to kind of maintain this, Felicia? Obviously, you know, it's surgery, but it's not something that's going to completely change and be permanent. What are you going to do to kind of keep this up?
Just gonna exercise more and improving my eating habits.
Yeah. And Ginger, you know, she has exercised quite a bit. She's been eating right. She's been exercising. But it's just, you know, these pesky pounds. She's in her 40s. And, you know, like a lot of people at that age especially, you just have those 5 or 10 pounds that you need to kick. And so that's what she's doing here today.
Hard to get rid of that. Okay. I got another question for you when we come back to you.
Okay. We'll see you again.
Yeah, okay. Very good. Thanks very much, Janie, for that.
She obviously is in great shape.
I was going to say, she really didn't need a lot of work to begin. She's slight. Janie, thank you. We'll get back to you.
Sure.
Okay, it's an area of the body that you really can't do anything to exercise away. We're talking about the under the chin area, that little area right there. You just want that little extra fat to go away.
Some call it the gobbler. One of those people who would like it to go away is 42-year-old Felicia Murray. She agreed to let the morning show actually come in, and she's getting 3 liposuction procedures done today live on the morning show. And 10 News reporter Janie Porter, she's been with her all morning at the Bassin Center for Plastic Surgery all morning long. And Janie, I mean, we keep checking back with you. She's a trooper. She seems to be doing very well.
She is a trooper, you guys. I mean, she's been really calm through the procedure. I think right now might be one of the more complicated parts for her because, like you mentioned, she's getting that under the chin area done right now. Now, This is a real procedure, so what you're seeing is graphic. I mean, we just want to warn you, obviously, if we're showing live liposuction, Aqualipo as it's called, you're going to be seeing the real deal. That's what we're bringing you here on the morning show. Dr. Rigo Mendoza is doing the chin area right now. What are you doing? This is the laser part, right?
This is the smart lipo. The laser's going underneath right now, and we're just melting some of the fat. And here especially, we are trying to heat up the skin as much as we can so we get a lot of skin tightening and we get rid of that loose skin.
And Felicia, I know that you mentioned you'd seen a few times on TV just different exercises that you could do to try to get rid of the under the chin area, but I mean, nothing really worked, right?
Right.
How are you feeling right now? You have the numbing fluid is what's kind of under the chin right now, making it a little bit, looking a little bit bigger than it would normally. How has the under the chin area been? Because I know you were the most nervous about the abdomen, which you've already done.
Well, it's kind of funny feeling right now, and it's kind of hard for me to talk.
That's true. You know what? You just relax, girl. You're under enough today. I'm not going to make you talk anymore. But what Dr. Mendoza is going to be doing after he does the laser is he's going to use a water sprayer to kind of power wash all of the fat out. That's what Aqualipo is. It's $3,500 for the first procedure, and what after that?
And it's $2,000 any additional areas.
This is a brand new procedure in the U.S. at least. It's from Germany, is that right?
The body jet machine was developed in Germany, correct, and it just came to the United States last year.
Well, you've talked about a lot of the benefits as we've been through the morning show today, but I think the one that sticks out to me is less time and less recovery time, right?
Correct. A lot of my patients will go back to work in a day or two.
Guys, do you have any more questions? We've been out here all morning, and by the way, by the end of this under the chin procedure, she'll be done for the morning. You're going to see that within about 5 or 10 minutes. We'll bring it back to you.
Yeah, I've got a question. I got a question for the doctor. Is this the only liposuction he does now, since this is the newest and greatest, or does he offer the old version of liposuction?
Is this the only type of liposuction you do? Do you do traditional as well?
I've done every type of liposuction. Now, with the benefits of this, I do almost exclusively Aqualipo or Smart Lipo.
A Smart Lipo is the laser that you see right here, and this is a training center for Smart Lipo, but what's really the newest part is the Aqualipo, which is that power wash.
Correct.
Water sprayer.
Correct. That makes it easier to get the fat out much gentler than with the traditional liposuction.
About 20 minutes after this is done, she'll be able to go home. Technically, she could go back to work tomorrow if she wanted to, but she's going to go back on Saturday, guys.
Yeah, I guess the other question I have, Janie, because a lot of women want to know about the instant results, right? What did Felicia weigh when she walked into that office this morning, and what will she weigh? Because they're sucking a lot of things out of her right now. What will she weigh after this procedure is done?
Right. And you know what it mostly is too, Ginger? It's mostly the volume. And so if you look over here to these canisters, this is how much fat that they've sucked out of her just as we've been here. This just started around 5 this morning. Wow. So it's really more of an inches type of thing. The doctor couldn't really estimate that, but we will wrap this all up for you. And if you missed any of the show this morning, 10 News at noon, we'll kind of wrap everything up and talk to Felicia afterwards.
Yeah, that is a lot. That's
a lot of
crazy,
food.
right?
Yeah, that really is. All right, thank you, Janie. Janie's very brave for being in there because I can't even look at it.
You've been a little squeamish all morning.